Hello, my name is Jessie Thurber-Dean. I am a student of CSU Global, and today we are going to talk about the electronic health record. We will review the capabilities of the system, how meaningful use in MACRA have impacted the use of EHRs, legacy systems, barriers to adopting this technology, and recommendations. Thank you for joining me today, and I hope that you learned something new. In 1999, the Institute of Medicine's report To Error is Human called for developing and testing new technologies to reduce medical error, and the subsequent 2001 report, Crossing the Quality Chasm, called for using technology as a first step in transforming and changing the healthcare environment to achieve better and safer care. This was the push that healthcare needed to start the journey in improving care through the use of technology. The electronic health record is an electronic medical record that collects and stores data, shares patient medical information among healthcare providers, allows providers to enter orders into the computerized provider order entry system called CPOE, helps assist providers with clinical decision support resources called CDS, and standardizes practice with evidence-based practice. EHRs also help reduce medical errors, provide effective communication between members of the healthcare team, lower costs of healthcare, and improve the coordination of patient care. Wagner, Lee, and Glasher state that there are three major benefits of the EHR system. They are quality, outcomes, and safety, efficiency, improved revenues and cost reduction, increased patient and provider satisfaction. In 2009, the American Recovery Act and Reinvestment Act was created as an economic stimulus bill in order to help the United States recover from the economic downturn that started in 2007. In 2009, ARRA created the U.S. Health Information Technology Act, called HITECH, program that incentivized healthcare systems to adopt EHRs in order to improve patient safety and the quality of care delivered. The incentive was funding provided by CMS for those meaningful users who not only adopted the EHR system, but utilized the system to improve patient safety, quality, reduce medical errors, and avoid unnecessary costs. The Meaningful Use program was started in 2011 by CMS. The current focus of today's healthcare culture is on improving patient safety and the quality of care delivered. Therefore, we will continue to see the evolution of the EHR as technology improves. We're going to take a moment and watch this video about EHRs.
Your electronic health record is one of the most valuable sources of information you can share with all of us. So let's talk about what it is and why it's important. Your electronic health record, or EHR, is a record of the care you've received from your doctors and medical facilities. It's created and updated by your healthcare provider and includes things like health issues, medications, and treatments. If you see many healthcare providers, you may have many EHRs. Because it compiles the history of your medical care, your EHR can show a more complete picture of your past and present health than other sources of information. And this is why it's an important part of the All of Us research program. When it's linked to other health information you provide through the All of Us research program, it can help researchers spot patterns in what makes us sick or healthy, and why. These patterns can reveal important new medical insights that could lead to better preventive care and treatments for future generations. With great data comes great responsibility. The All of Us research program has a team of experts who work to ensure the security of your data. And we'll make sure your data is used ethically and responsibly to improve health for generations to come.
The EHR system has so many more capabilities than our previous documentation system of paper. These capabilities include CPOE, CDS, e-prescribing, EMR, BCMA, smart pumps, automated dispensing cabinets, patient portals, and electronic incident reporting. The computerized provider order entry system, CPOE, enables providers to enter medication orders, tests, and procedures. The clinical decision support system, CDS, is designed with tools to enhance the provider's decision-making and clinical workflow. CDS integrates with CPOE by guiding the providers with the correct medication doses, routes, and frequencies, and guiding providers with the standards of practice for laboratory testing and other medical testing. The e-prescription function allows providers to electronically enter prescriptions and print them out for the patient or send them directly to the patient's pharmacy of choice. This function improves patient safety by not using handwritten prescriptions that may not be legible. The Electronic Medication Administration, EMR, is the patient's medication record that is located in the EHR. An important function of the EMR is BCMA, Barcode Medication Administration. That is when the nurse scans the patient's medical armband to ensure they have the correct patient. Then they scan the medication that has a barcode on the medication packing. This barcode double-checks that it is the correct medication, correct dose, correct route, correct time, with the medication order that's located in the EMR. Smart pumps are infusion pumps for medications that have medication libraries, which means it has the standard of care information about medications and the rates they should be infused. When a nurse programs a pump and say it's outside of the window of safety standards that have been set, the pump will alert the nurse of the concern. Automatic dispensing cabinets, otherwise known to a lot of people, Pyxis, are medication storage cabinets that control, manage, and track the dispensing of medications. ADCs are managed by the pharmacy department and help the workflow efficiency by decreasing the manual delivery of every medication needed. Patient portals are an online application that is secure and allows the patient to view their own medical information and allow easier communication with their providers. Say they need a medication refilled, they can put that request through their portal without even having to leave a message, and the provider knows that they need a refill at the pharmacy. The last capability that I will go over is incident reporting through the EHR system. This allows any healthcare worker to enter an occurrence report when there is a patient safety event or near miss. Since it is in the EHR, it easily ties with the patient's information so that tracking and trending can occur. As you can see, there are many capabilities of the EHR system, and all of these help to improve patient safety. But, as the IOM stated in 1999, to err is human, and mistakes can still occur with all of these features in place. Meaningful use is a part of the High-Tech Act of 2009, and in 2011, CMS began the Meaningful Use Program. The Meaningful Use Program established standards for the EHR system and offered compensation for those who adopted and met the Meaningful Use criteria for an EHR system. In the beginning of Meaningful Use, it was a challenge for all facilities, no matter how big, how small, to meet the standards and criteria that were set. Meaningful Use helped motivate hospitals to adopt the EHR system with system capabilities that improve patient safety and quality of care. The literature supports the fact that those hospitals that were early adopters of the EHR Meaningful Use have a higher patient safety culture than those who did not achieve this in the early phases. MACRA is the Medicare Access and CHIP Reauthorization Act of 2015. Describes alternative payment models as new approaches to healthcare payment that incentivize higher quality and value. MACRA provides incentives to physicians to use APMs. An APM specific to providers is a physician-focused payment model in which payments by Medicare are based on quality and the cost of physician services. As government reimbursement programs continue to become more stringent, healthcare will keep moving ahead, adapting and adjusting to the changes necessary to provide safe and quality patient care. Legacy systems are older versions of documentation being either paper or an older EHR. Transitioning from a legacy system to a new system can be stressful for staff as it may add additional time up front to learn the system and become more efficient. An important point to make with the transition of legacy systems to new systems is to have a plan for data integration from old data to the new system. This enables a more seamless transition from one system to the next and allows for patient safety and better continuity of care for patients and providers. Technology has evolved since the creation of the EHR. However, with any technology system, there are barriers to adoption and usage by hospitals and providers. The biggest and most consistent barrier to adopting an EHR is the cost, even with the incentives provided by the government. The other major barrier themes are getting appropriate buy-in from hospital and physician leaders, technical concerns about functionality, usability by physicians and staff, and integration ability. The other crews listed the following barriers, which again include costs, lack of capital resources to invest in the EHRs, financial challenges of the hospital, cost of purchasing an EHR system, initial costs with the HIT, complex criteria with meaningful use that is difficult for hospitals to obtain, lack of support from leaders and physicians, which include cooperation and attitude, lack of adequate IT resources, support and technology, concerns with workflow, concerns with timeline implementation, and concern with the actual internet capabilities of handling this system. Recommendations in order to have a successful EHR system. First, you need to assess your current system. Is it meeting your needs? Do you have the right resources that can support an upgrade or change? If the answer is this meeting your needs? No. And yes, you have the right resources, then you need to get buy-in for this change. You need to create a steering committee with a project manager. You need to establish the what, why, and how of this system. Include the standards of practice and regulatory guidelines. You need key stakeholders, including physicians and frontline staff, to help build this system. Determine the EHR requirements, the CPOE, CDS, BCMA, EMAR, e-prescription, smart pumps, patient portals, health information exchange, incident reporting capability. You will look at vendors and invite them to give you a request for a proposal. After that, you will invite the vendors in for a demo of their product. You will then have a final decision and contract if you do choose a vendor. Once you have that, you will need to have a very organized implementation plan with dates for education of staff and providers and the dates for the rollout of the facility. In conclusion, EHRs are our present and future of healthcare. Therefore, we as healthcare leaders need to figure out how we get on board and successfully adopt and adapt these electronic systems into our health systems. Thank you for joining me today. I hope that you learned something new about electronic health records, and have a wonderful Halloween.